Unit 6. Individual Differences. Presentation 6. Biological Therapies, Drugs and ECT.
In this presentation, we'll be taking a look at biological therapies used in the treatment of abnormal behaviour. Biological therapies are part of the more general biological approach to abnormality. Drugs are widely used in the treatment of abnormality. For example, antipsychotic drugs are used to combat the symptoms of serious psychological illnesses, such as schizophrenia. Antipsychotics such as chlorpromazine work by blocking the action of the neurotransmitter dopamine, and so reduce many of the distressing symptoms of schizophrenia.
A more widely used group of drugs are the antidepressants, which, as the name suggests, are used in the treatment of depression. The most widely available antidepressant drugs are the selective serotonin reuptake inhibitors. SSRIs block the mechanism that reabsorbs the neurotransmitter serotonin after it has triggered a nerve impulse. This has the effect of prolonging the activity of serotonin, which in turn reduces many of the symptoms of depression.
A final group of drugs are anti-anxiety drugs. These work by providing short-term relief from the anxiety associated with stressful situations, such as performance anxiety or examination stress. Different types of anti-anxiety drug achieve this in different ways. For example, benzodiazepines, or BZs for short, reduce anxiety by slowing down the activity of the central nervous system. Beta blockers reduce the activity of adrenaline and noradrenaline, part of the body's stress response. This creates an overall calming effect.
Drugs work by targeting the physical symptoms of a disorder, usually by altering the action of neurotransmitters in the brain. This has the effect of changing the internal chemistry in the brain, reducing the symptoms, and so normalize the behavior of the individual.
Evaluating the use of drugs to treat mental disorders. A particular strength of drug treatments of abnormality is the fact that they work, in that they change people's behaviour for the better by reducing distressing symptoms or reducing anxiety. They are generally more effective than a placebo, which is a pill with no active component.
When drugs are combined with psychological therapies, they can be particularly effective, more so than when drugs are used on their own. Antipsychotic drugs used in the treatment of schizophrenia are popular for the simple reason that they offer hope and improvement for people who might otherwise exist in a state of hopeless misery.
Drug treatments are also effective because, compared to other forms of treatment, they're relatively easy to use. They require little effort from the patient other than actually remembering to take them. As a result, people tend to be more motivated to continue with their treatment program. Because of this, they are more likely to get better, a clear plus for this type of treatment. However, while other treatments such as stress management, exercise and self-help techniques require more time and effort initially, their advantage over drug treatments is that they boost mood without any adverse effects.
However, drug treatments are not without their problems. First of all, drugs can only tackle the symptoms of a disorder rather than the cause. For example, anti-anxiety drugs can make a person feel less anxious about something, but they do nothing to resolve the underlying cause of the anxiety. As drugs only offer a person temporary relief from their symptoms, as soon as they stop taking the drug, the symptoms tend to return.
Another problem for many drugs is that they have side effects, those unwanted additional consequences of taking a particular drug. For example, some individuals taking SSRIs report feeling nauseous, and SSRI medications can also increase the risk for bone fractures and bone loss in older adults. These unpleasant side effects are the reason why many people stop taking their prescribed medication, which in turn reduces the effectiveness of the treatment.
The second biological therapy we are going to look at is electroconvulsive therapy, or ECT for short. ECT can be used for severely depressed patients, particularly those for whom drug treatments have proved ineffective, or for those who are so severely depressed that suicide is a real risk. It may seem bizarre why anybody might have thought that this was a sensible way to treat a mental disorder. The idea came from the early observation that some people with severe depression who also had epilepsy appeared to feel better after having a convulsive fit.
Let's start by looking at how ECT works. First of all, an electrode is placed just above the temple on the non-dominant side of the brain, and a second in the middle of the forehead. This is known as unilateral ECT, and is more commonly used today than the older bilateral ECT, where an electrode is placed above each temple. The patient is then injected with a short-acting sedative, so they are unconscious when the shock is administered. A small amount of electric current lasting about half a second is then passed through the brain. This is sufficient to produce a convulsion which affects the entire brain. This treatment is repeated as many as 15 times over a period of several weeks.
Why ECT works is still a source of some considerable disagreement among clinicians. It is known to cause changes in the way the brain works, possibly by affecting the action of neurotransmitters in some way. ECT may improve communication between different parts of the brain by causing the release of neurotransmitters, making them more likely to work and so help recovery from the symptoms of depression.
Although ECT remains one of the most controversial treatments used in the treatment of abnormal behaviour, one of its undoubted strengths is that it does appear to work. Coma claims that up to 70% of patients improve after receiving a course of ECT. However, critics have pointed out that the vast majority of these have relapsed within 6 months of completing their treatment. This suggests that the treatment is not really effective in the long term.
However, and perhaps this is the most significant strength of ECT, it saves lives, particularly in cases of severe depression. The Royal College of Psychiatrists estimate that approximately 15% of people with severe depression go on to kill themselves. There is a good chance that ECT would have saved their lives. Therefore, the overall benefits would be considered significantly greater than the risks. However, despite its undoubted short-term benefit on reducing suicide risk, little or no evidence exists on its benefits on reducing suicide risk over the long term.
A weakness of ECT is the possibility that any improvement in patients has nothing to do with the fit itself, and more to do with the extra attention and support the patient receives. There have been several studies that have compared real ECT with sham ECT, that is, where the patient has exactly the same procedures as normal, but no shock is given. In these studies, patients receiving real ECT were more likely to recover, although a percentage of those receiving sham ECT also showed a reduction in their symptoms.
This suggests that, at least for some, simply receiving some form of medical attention helps, possibly because it offers them some hope of recovery.
A second weakness of ECT is that it too has side effects. These include memory and other cognitive impairments, and cardiovascular problems such as raised heart rate and blood pressure, although these are usually only temporary. A Department of Health report in 1999 reported that about 30% of patients who had received ECT during the previous 2 years claimed that it had left them with permanent fear and anxiety.
What can we conclude about ECT? ECT may well be controversial as a form of treatment. There may also be disagreement over why it works, and even if it does work. But for severely depressed patients who are resistant to other forms of treatment, it can literally be a lifesaver.
What can we conclude about biological therapies? Each of the treatments we have looked at have been focused on physical changes as a way of altering our psychological experience. For example, changing mood, reducing anxiety, and so on. The fact that we experience such feelings and emotions psychologically does not mean that their origins are not physical in nature.